she's going to talk about the patient's voice.
Hi. I'm going to talk a little bit about the voice of patients' families, especially their caregivers. I'm Cristina Ojeda from Madrid, Spain, and I'm an orthopedic surgeon. And I'm going to quote Rosalind Carter, the first lady of Jimmy Carter. She said, "There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers." So I think with that, we have everybody. There's a recent survey that has been done in Europe. It's called Entwine. That's the European Training Network on Informal Care, and it states that 34%, so 1/3 of the European population, are informal caregivers. And 80% of long-term care in Europe is provided by informal caregivers. Caregivers report lower mental well-being than non-caregivers. And the average age of caregivers is 50. Usually when you're 50, you have other priorities in your life than taking care of somebody. So many times we talk about patient's interest, we talk about system efficiency and all of that, but the caregivers are perhaps the forgotten victims. This is a retrospective analysis of prospectively collected data. And they looked at the caregivers at 6-month follow-up, and they saw that the caregivers had decreased their work hours, it had affected their finances in 1 of 4, and it had hindered relationships. And 20% reported a high caregiver burden and depression, but most of them cherished the time they spent with the care recipient. This prospective cohort study from Patrocinio, which Marta Mora just jumped in for, is a prospective cohort study with 172 caregivers. 55% of them were daughters of the patient. In Spain, it's just a matter of fact, it's not asked. It's usually the daughter. And predictors of high caregiver burden, and it was 50% at 1 month, were low prefracture function, postoperative complications, the older age of the patient, and younger age of the caregiver. In Greek hospitals, this is not only for hip fractures, but other types of admission as well. They studied 5 wards in the tertiary hospitals, and most of the caregivers were females, and over half remained at the bedside over 17 hours a day. I want you to imagine that, over 17 hours a day. And the reasons they gave for being at the bedside was emotional support, better communication with the healthcare professionals. They want to be there and they want to be informed. Patients trust their family, so the caregiver, more than nurses. There's a shortage of nursing personnel and they want to help. And also, it's just a matter of fact as a family tradition of caring for one another. I think I have difficulty with this thing as well. There's an interesting study from the UK, the longitudinal study of aging, and regarding hip fractures, unpaid caregivers increased during the fracture period, so it went from 29% of informal caregivers before the fracture to over 50% of patients with informal caregivers, and then it plateaued, and it usually was, especially in the fracture period, the daughters. And this is a study that we're going to try to publish. It's from Paula Gil Vicedo. She's a student. Well, now she's a doctor. In Spain, you have to present a master's thesis in your last year of university, and she prepared one about informal caregivers in our hospital in Spain. She did a structured interview of 47 caregivers and patients 1 to 3 months after discharge. 70% of the caregivers were females, 82% were daughters, and 76% of them worked. They were actively employed. And we did the SARED burden interview, which is actually is a structured interview of 22 questions that asks about burnout, and 64% perceived overload. And the overload was more likely in female caregivers, in patients that had cognitive impairment, and patients and if you live together with the patient receiving care. And there wasn't any relationship with patient age or ability to walk or perform ADLs in our study. In this systematic review of 23 studies, they saw that interventions, they studied if you could train or do skill-based programs and home visits, telephone follow-up, etc. And in this structured systematic review, they saw that there was no benefit of these interventions on patient or caregiver quality of life at 12 months, or anxiety at 12 months, and no consistent effect on function, depression, health resource use. But there is a limited quality of studies and high risk of bias because most of these studies were on stroke, which is a completely different animal. So this systematic review might not be applicable to hip fracture patients. And I also like this study from Welsh. This is the hip feasibility trial, so we're going to have probably results of this trial in a couple of years. They did 10 interviews with caregiver patients' dyads over 5 sites in England, and the common themes that they brought up were the expectations of care and services. For example, many caregivers stated that it was a matter of fact that they would take care. Nobody actually asked them if they would be available, and they felt overwhelmed with that responsibility. And also, another one is being responsible and advocating for your patient and for yourself. So navigating the care system, especially transitions of care, it links up very much to what the speaker before me had said, Marta. Most of the interviewees were first-time caregivers with no experience, and they expressed confusion and frustration. So the American College of Physicians, they have a working group on how to work with caregivers, in that you have to identify them, so ask them, and this is a good tip, always ask what the patient, the person, the relative accompanying the patient is in that sense. Don't state as a matter of fact it is the daughter, it could be his wife, something like that. Also acknowledge them, express gratitude for their work on behalf of the patient, support them, so give them resources if they need it, and engage them, so make them feel validated and recognize their effort. One of the problems is the increasing share of women in the workforce, and I've looked at, this is our world in data statistics. In Iceland, there's been a very high proportion of women in the workforce for the past 30 years. But for example, in Spain, there has been a notable increase, which is a dark green line. And in Turkey, it more or less is around 40%. This increase, I'm going to take, if you were late, you can have the patient. Anyhow, this leads to the issue that, especially for example in Spain and Italy, where there's increasing incorporation of women in the workforce, that they're not available anymore for taking care of their mother, father, whatever. This is a problem because somebody has to do it, because the care systems haven't been prepared for this, and there is a lot of age, and it's happening quite of a sudden. This is probably not that much an issue in Northern Europe, where there has been a feminization of the workforce for the past 20, 30 years. So they already have their social structure set in place, but especially in Southern Europe, this is a problem. So you're going to find, I'm going to try this, there. There's an unofficial word in Italy that's called badante, which is caregiver. And you can actually see signs on the streets where badantes, so these informal caregivers, are offered. And in Italy, 1.3 million informal caregivers take care of the elderly. And this is 1.18% of the Italian GDP. Most of them come from Eastern Europe, and many of them also from Turkey. And this is a sort of submerged private social system that affects several policies. And it affects healthcare, it affects social policies, taxation, immigration, many of them are illegal immigrants, labor force, etc. And this is a similar phenomenon in other regions, and the International Organization for Migration has actually looked upon it. And many times, these informal caregivers have to actually be regularly recognized, so there have to be immigration policies to regularize their situation, because you cannot just send them back. So this is just 2 pictures from Spain. You have a sign on a lamppost saying, Romanian woman looks for a job as an internal caregiver, permanent, to take care of older people, for cleaning, for ironing, etc., and with a telephone, or just taking out old ladies to the walk in the park. And in conclusions, accelerated aging and female presence in the workforce increases the strain on informal caregivers, and this will occur in the next decades in low and middle income countries. So this is what happens now in Southern Europe. So when in India, China, and the other countries from where the caregivers are coming from, Latin America and Spain, that's going to be a problem in the next 30 years. I don't know exactly how we're going to solve that. This is different of other conditions like cancer or Alzheimer's because hip fractures are sudden. It's from day to tomorrow, all of a sudden, you have a dependent older person in your family. And the expectation, of course, you're going to support, it's not a matter of fact. Not everybody's available, not everybody wants to. And caregivers and families are many times overwhelmed by goals set and pathways. And it's hard for them to navigate the care system because many times, for them, it's the first contact they have with some sort of dependency. So there's an increased reliance on informal migrant supports, which creates a submerged care system with economic, taxation, migration, and healthcare effects. And we should acknowledge, listen, and support family and caregivers. Thank you very much.